Okay, so we're building now off the foundation of a stable shoulder blade, and we're going to add the first muscle of the rotator cuff of emphasis called the supraspinatus. And the motion we're going to utilize is the act of thinking of dumping out a glass of water, okay? So we're going to think that in your mind. With the shoulder blade, we thought of the handshake. Now we're going to think of dumping out a glass of water, okay? So we'll first of all reactivate the first muscle. So think of the handshake first and just have your body straight ahead. Yep, let the fingers pull the elbow, staying relaxed. And when you feel the shoulder blade drawn into your body, okay, you feel it? Mm-hmm. So you want to try to preserve that. And then now, so come forward partially. Now just stay here, and now you bank the arm over to the thumb side of the palm. Remember, you're going to think of dumping a glass of water, and just try to keep the shoulder down. Remember, you're floating. Okay, there you go. Now, where you should feel this is across the top of the shoulder. So the rotator cuff, and this is one of the most commonly torn portions of the rotator cuff, so frequently it's inhibited, and so we want to have a very gentle activation of that muscle. And so its role is to initiate the motion. It's a counterbalance to the deltoid. So the tendency is for the deltoid in the front to hike the shoulder, hike it actually forward. And so we want that pure spin to be preserved here, and this muscle is a key contribution to that. In fact, if this muscle is inhibited and we can reactivate it, it has a profound benefit to the rest of the muscles. It's kind of like the general of the shoulder. It's a communicator, and its absence is chaos. There's disorder. So it's a critical muscle to put a lot of emphasis in, and you'll reap the reward for it. Okay? Now, once it's active, then you could take your hand down, and then now, so you just do the handshake, the thought of the dumping the water. But then you have those active, and then you start to use that. So you just start to reach in different directions and just make it like a purposeful movement. But remember what you felt here of that pure spin motion of the shoulder joint in the socket.